Hi, my name is Michelle and I'm a mom of 13 amazing kids. Today we have Millie's last cardiologist appointment before her surgery. Here we go. You want to come along? Okay, but before we get started, I just want to say to you that I didn't post a video yesterday. I normally post on Monday, Wednesdays, and Fridays, but I didn't post yesterday because I knew we were going to this appointment today. So always hold on just in case, and then you'll find out the next day why I didn't post the day before. And last week we were gone and I made a video about our vacation, so be on the lookout for that. It's coming up tomorrow. And then the following day, it's 4th of July, so by Friday you'll see our 4th of July video. So I hope to see you there and enjoy this little tour as we get to go to meet Millie's cardiologist. Although we've already met her, you haven't, so, or met him. But this is her last appointment, like I said, with the cardiologist before she has her heart surgery. So we're pretty excited about that. So come along, let's go. As we arrived at the heart center, we go straight inside and then we go upstairs. Get Millie in the stroller. We're on our way to the cardiologist.
Someone's coming in.
She's so cute. Is this with the aisle that we're getting off? So we're really glad that we're going to see the cardiologist today because a few things have changed and have come up that let us know it's getting closer to her having her surgery. And we'll get to those in just a minute here. But right now we're just going to get to the office. Here we are at the Children's Heart Center, and we have absolutely loved the team and the surgeon and everybody else we're getting to know right shortly. We'll go inside and we'll sit in the waiting room. We're usually around that corner and sit in a private area. Then we go straight to the area where we're going to get her weighed. And we didn't have to wait long at all today. So they're going to put her on the scale and figure out how much she weighs, how long she is, and all that different stuff that just help us learn more about our baby's progress. And she has been progressing for sure.
So she is 11 pounds, 8 ounces.
Of course, her legs weren't on it.
It's all connected.
Down here.
Oh, good.
Head this way, feet towards us.
Yep. So, I got you. I got you. Mommy's got you. I got you. Hands off your face. That's right here. She's just getting ready to put on the pulse socks so that she can find out what the baby's saturation levels are and how well she's breathing. And it's not always easy for her to get that on Millie. She's so wiggly, but we'll figure it out. And usually after she does that, then she'll put on the stickers so that we can get Millie's EKG read. She'll have to hook up each of the little attachments, and it's definitely getting easier now that she's older. It was much more difficult when she was such a teeny tiny baby because she didn't have much area to put the stickers. But it's better now, and we should be able to get a pretty good reading today.
So what is going on?
I'm extremely happy today because I found out some exciting news about, even though the doctor told us today that she might be in the hospital for up to 10 days, we did find out that as soon as they're able to take her tube out from the ventilation, that I'll be able to hold her and most likely be able to nurse her, and I am so thrilled about that. You couldn't make me a happier mama, that's for sure. Millie loves to nurse, and it will just be so exciting for me to be able to nurse her again after that surgery, and I'll be able to do it as often as she wants. He's gross. You're all decked out. Not too close, you go back a little. So they'll pretty much let us know where she's at, but she was sitting at 95% today, and that's not normal for her. She normally sats at 100%, and at the lowest at 98, 99. So to be at 95, it definitely means that the heart's changing and some things are going on. But we'll find out more as time goes on, but it's definitely time for her to have her surgery. And then I'll just take these little gel tablets, tabs off. They're kind of like that little sticky stuff that you get on some packaging to hold it closed or whatever. So they come off pretty easy. They're kind of gummy on the back. but I just take them off real careful, but I'm kind of guiding them with my fingers, and then figure her skin must be itchy, so I go ahead and massage it a little bit, scratch it a little bit, just because I know if that was me, that's what I'd want, and she seems to like it, so I go ahead and do it. It's still perfect. No harm done yet.
She's getting surgery done?
Yeah, 3 weeks.
Aw. Let me
And
try
she
her.
likes to put her leg up. I'm like, I hope they don't mind if I put a blanket underneath her, because she always does that.
Yeah. Sorry, Mom. Just take
It's
her
okay.
for a slap again.
It's okay.
Let's see. Let's try your toe.
She's like, yeah, right.
She's like, no.
Like,
Oh,
oh,
what are you doing?
she's eating it, eating the hair bow. Little skin's pinning. We took her camping for her first time.
Yeah.
She got a little bit more sun than we realized. I didn't know they can get sun in the shade.
Oh, wow.
I was like, are you kidding me? I never do this. I've never done that way before. You like it when I do that?
It's finally working.
95.
Normally you're at 100. What are you
Let's see.
doing?
Oh, let's see.
He's so sweet. Yes, you are. Yes, you are. Yes, you are.
Yeah. You are doing it. All right, here, we just keep her undressed, okay, Mom?
I will. I know the drill by now, right?
Yeah.
That's your front.
There you go.
Okay, come here, Slave Pig. Finished in there, we go walking down the hallway, and we'll go to the room where we'll see the cardiologist, and he'll do the ultrasound or whatever he does right there. And we'll just get settled in here and be ready for him. And then we come in here and we wait for the cardiologist. So he will come and he will scan her. She'll lay right there on that bed, and that's what we'll do. We'll just sit here and I'll show you a little bit of that, just so you can get an idea of what we've been doing this whole time. Sorry, I can't stretch my arm out any further. Millie's just watching everything going on. See? Hi. So right here you can meet Dr. Rollins. He's Millie's cardiologist and has been with her since she was in utero about 21 weeks ago. We're getting closer. They gave us the 26th as a tentative date.
Your surgical date is the 26th? Okay.
Tentatively. We haven't had the
Starting to
surgery.
get more remembered finally. Maybe those lungs are finally
Yeah, and her stat was 95 this
swapping
time,
out
and
for us, yeah.
she's normally at 100.
And her precordium's a little more active when you feel it.
Well, she sweats now almost every
She
time
does?
she eats. And she didn't used to do that. Now it's
Yeah.
like, holy crap.
The more symptoms of congestive heart failure.
Yeah. There was a lot of signs that show that she's getting more of the CHF, and I don't even know how that affects that.
So he's actually, what he was saying, she's showing some signs like the heart murmur is more prominent, the worker breathing, the fact that she's sweating when she nurses. However, but the heart failure, he would have expected to see more of the heart failure signs than she's showing. That's why she doesn't need the Lasix. But so the heart gets overworked, and he kind of explained this. As it gets overworked, it grows, it gets bigger because it's having to expand and contract harder than it should. And then as that happens, it gets weaker and eventually it fails. So that's congestive heart failure. And then when that happens, it has a hard time returning the blood all the way through the body. And as the left side fails, then the right side will start to fail. Because, and it's just not, it's having a hard time returning the blood. As that happens, the fluid gets stuck in the legs and in the lungs, it builds up. That's why he said that he thought she would have had to been on Lasix by now. He's really surprised that she hasn't. And what the Lasix does is it just helps them get rid of the water that is building up in their body in the extremities. And that hasn't happened yet. And one good thing, he said that it's kind of good. He wants to see so much of the heart failure before the surgery so the heart gets large enough so that as they're putting the needle through it to repair it, that it's big enough so it doesn't affect the electrical flow of the heart, if that makes any sense. So the bigger the heart is, the less chance it will damage that. Because if that gets damaged, then she'll have to get a pacemaker. So that's all I can think of right now.
You know, I saw a cute video going around on Facebook about this Down syndrome dad and I assume autistic mom, I don't know, but they had a normal baby.
Wow.
He's like 5 feet taller than them, you know.
Wow.
Good looking man, and he went to dental school and he's a full-blown dentist, and he said his parents were the most awesome parents. He never wanted for anything. They were so good to him, and he
That
loves
is a
them
cool
dearly.
story.
Isn't it?
Would you see that on the internet somewhere?
Yeah.
Wow.
I was like, that is awesome that stuff like that's going around. Or you've got the one Down syndrome girl, she's full-blown Down syndrome, and she's like an Olympic medalist for Special Olympics. From meeting with the cardiologist, now we go over to do the B&P, which helps us know the ratio that her lungs and heart are actually working together or not together, so we know if she has to start Lasix or not. We haven't received a call yet, so it looks like she's probably in the clear. But see, she don't cry near as much about stuff like that. She still doesn't like it, but
Oh.
she's like, enough already. She got sunburned and then she scratched her face. I'm like, geez, you look like you've been through a war. A baby war. Is it always hard to get it out of their heel?
It just depends.
Or does she?
Like, she's a little cold.
Okay. Well, I should have warmed her up before we brought her in here. I thought I was. But her feet were dangling. She gets hot really fast. She's sweating more. That's why they're checking everything. Her sat's dropping. And he's like, yay. This is all good stuff. And don't get me wrong, this is the hardest part as a mom, to have to watch your baby go through pain. And even though we've done this a few times already, it doesn't get any easier. Sure, I don't have tears streaming down my face today, but I sure feel like it. I'm just trying to keep talking for Millie's sake so that she feels a little more comfortable with a familiar voice and my familiar touch. But it's tough, you can tell. It's not easy for her, not at all. But we're just about done, and then we'll go home. And then we get on the elevator and we're done.
Doors
Millie,
open.
we're done.
Prepare to enter.
So I hope that you enjoyed this video, and I hope that that you're comfortable knowing all the details that we were able to share today, and I hope that you realize that this isn't easy for us. It's probably the hardest thing that we'll ever do, and we're just a little bit nervous, but that's understandable, right? We have complete confidence in the doctors and the team of doctors, and I mean, there's so many different teams that'll be working with her that we're really excited about that. And so I'm really not worried about anything in that sort of realm, but it was a good day. We were able to get a lot accomplished, and I hope that you were able to understand what we were talking about. So thank you so much for being here. We like to post on Monday, Wednesday, and Friday, but this week, because I knew we were coming here, I knew that this would be a better day than yesterday, because you'd get to come with us to see the cardiologist. So here we are, and here we were, and we had a great time. So I hope that you take care, have a great week, have a happy 4th of July. Do expect a video from us for tomorrow. I'm going to give you a video about our visit to our vacation that we had last week, and then on Friday you can see our 4th of July video. Take care. We'll see you soon. Bye-bye. just want to show you what she's wearing real quick. She's just sleeping away, and I just want to show you. She's so cute. This is her afterwards, but I'm going to put it in before because I didn't get to film her getting ready. I already took her little sockies off and her little headband off that you were able to see in the video, but isn't she just precious, sleeping away? Goodness sakes. I wish you could see her awake, but I'm going to post this video before that happens, so